Hello, everyone. My name is Charles Shear. I'm the Vision Science Consultant with Burtech Corporation. We're going to bring you another video on using the BVT in a clinical setting. Today, we're going to talk about adding cognitive demand to visual motor integration. The learning objective is to basically demonstrate how the BVT can be used to help with this. As you know, most traumatic brain injuries often affect processing speed and cognitive abilities. You add more cognitive demand, it makes the world tougher for them. So we want to use the BVT Go No-Go module to build upon those skills that we've developed and rehabbed in the speed module. The object will be for the patient to touch the green dots and avoid the red dots. First thing we want to do is establish a baseline. So we're going to go up and choose the same parameters. We're going to keep a large scale, large target, large sensitivity. We're only going to do this for 15 seconds in this video just to speed up and demonstrate. The display time will be 1 second, and 25% of the targets that will appear will be red or targets that the patient or subject should not touch. So when this turns on, they're instructed to touch the green dots and avoid the red ones. They have 1 second to make that decision. If they make that decision before then, it actually will advance to the next one. And you'll see the score here. There were 11 green targets presented. We got 8 of the 11. There were 6 red ones, and we made a mistake and hit 1 of those. And then it gives you the response times. If I keep the same size targets and sensitivities, but reduce the display time to 0.8 of a second from 1 second, the patient has less time to decide, so they're going to make more errors or more misses. They're so anxious to hit the dot that they often will mistakenly hit the red one just as a reaction. It's sort of similar to an anti-saccade. They're not supposed to touch it, but they can't resist. And in this one, you'll see that there were 14 presented that time. We got 8 of the 14, and we made no mistakes. On the other extreme, if we change the display time to 2 seconds, and if you have severe limitations, you may want to do this. The patient has quite a bit longer to decide, gee, do I touch that or not? So your accuracy will increase, but obviously they're given more time to make those decisions. And you'll have less targets displayed during that time. When they get really good at the go, no-go responses, we want to, just as we do with other programs, add more demand to the background. So if I say we're working with a hockey player and I put up a hockey background and we have the red and green targets just as we did before, all of the parameters the same. It makes it a little more difficult, particularly if one of the red targets hits on the red crossbar. We can make this more difficult by choosing a different background. And again, as with each time, you can check those responses. If we really want to make it more challenging, particularly when they're close to return to life kinds of skills, we'll use a motion background. And obviously, the more confusing the motion, the more difficult the task. This happens to be a background that proves to be difficult with this task because we have, in a sense, circles that are popping up, changing colors, and very, very distracting. But we can be very sports specific if we want. We can make the demand as challenging as um, they can stand, basically. This becomes very difficult, the OKN response. Um, Here, the eyes want to follow the stripes, but they're required to look at the dots. So you'll see a lot of micro eye movements and then big saccades over to the target. We can make that easier by reducing the contrast, just as we've done in other things. If we want a more realistic approach, we can go to the optic flow target. Here we're going from peripheral to central. We can reverse that and go from central to peripheral, and that simulates a course walking forward, a tunnel type of effect. And again, the eyes have a tendency to be distracted by the high contrast stripes, but they're forced to make that cognitive choice of hitting the green targets and avoiding the red ones. Thank you for your attention, and hope to see you with some more videos down the road a bit. Thank you.